to have good internet speed. You see here, 7708 is near stomach 36. Eight is on the thighs. Not to worry, when you get your digital link, you will have access to all this. This is a zone 10, which is on the head and on the face. There is also a zone called dorsal trunk, which is on the back, and a ventral trunk, which is on the front. These are bloodletting areas, which we will talk later, and I will not use the time to talk about those two zones now. All right, so let me get back to my slides. Let me get to my slides. So that is the kind of end of the recap of yesterday. Let me look at the chat. Is there any logic for 11, 22, 23? Is there any logic and so on? Okay, there's a question. Is there any logic for 11, 22, 33? All right, so I will answer that now. Each of the Tung zone, each zone, 11, 11 or 22 or 33, each zone on its own can treat the whole body. If you ask a Sujok practitioner, what can you treat, Dr. Sujok? The Sujok practitioner will answer, everything. If you ask a reflexologist, what can you treat? He will say, everything. If you ask a scalp acupuncturist, what can you treat? He will say everything. All right. So this is the coverage of each zone, making Tung very beautiful. Very beautiful. Zone 1 is like, in Tung, is like a Sujok practitioner. Zone 9 is a auricular practitioner. Zone 5 is a reflexologist. But we do not have as many points as those individual schools. All right. All right. Again, I'm not saying this is making Tung any more superior than any other school. That's just the nature. That's the nature of Tung. All right. Each zone, for example, knee pain. I can treat knee pain from zone 1, zone 2, zone 3, I seldom use, but I use zone 4. All right. Sometimes one of these zones will work better than the other. I hope I answer that question. All right. I cannot. We will leave question and answers more towards the end. Huh? All right. Now, new material. What is the underlying principle of Tung Acupuncture? Vamsi, everything okay?
Yes, sir. Fine, fine going on, sir. Fine going on. Yes, sir. Yes,
Fine.
sir.
Fine.
Yes.
Okay.
Yes.
If
Yes.
there's any big problem, you just on your mic. All right.
Yes. Yes. Yes.
So now we're getting into a little bit heavy stuff now. Actually, I would like to have a quick. Maybe I assume like yesterday, 50% are acupuncturists and 50% are not acupuncturists. I think that's about right. All right. So principles of Tung Acupuncture. How come Tung select certain points for certain things? His theory, he uses channel correspondence. The word correspondence means relation, all right? So channel, relation. What is channel? This channel is the TCM channels. The spleen channel, stomach channel, lung channel, liver channel. In the Tung system, they have a relationship. These channels relate. For example, if you have an injury in the lung channel, you can use spleen to treat. All right, you can use a large intestine to treat. This channel correspondence is a little bit like the 5-element diagram, whereby different channels will affect another channel through the mother and son relationship, the grandfather relationship. All right. So in order to understand channel correspondence, you have to know some level of TCM. Right. Dr. Tan balance method is a challenge correspondence school of acupuncture. All right. He's 100% talking about the relationship between channels. And this relationship is sitting inside the Tung system. And I use this Dr. Tan channel correspondence when I want to practice channel correspondence. One channel to treat another channel. For those of you who do not know acupuncture and you are not trained in traditional Chinese medicine acupuncture, you have not gone to Dr. Loya school, or there are many really good TCM teachers in India. I recommend that you take a course with them. But if you have not done any course, then what I've said in the last 5 minutes about channel correspondence, forget about it. Okay, just follow along. Okay, because if you try to stress on channel correspondence at this early stage, you might give up acupuncture. So this is one of the underlying principles in Tung Acupuncture. Number 2, imaging correspondence. This one, everybody can handle it. Right? Even those of you who got no basic acupuncture. Image correspondence. Correspondence means relationship. Imaging means, holographic. Holographic means sometimes it's imagination. All right. You look at the foot, the picture of the reflexologist center. Every reflexologist center, they will pin a poster of this picture. And you can find every organ of the body on this picture. And if you stimulate the points, you stimulate it, all right, with a tool or with your finger, there will be a therapeutic effect. So this is another school. And I'm not the one, and I will never say that my school is more superior than a reflexologist. All right, this is a unnecessary discussion. Then there are acupuncturists who practice ear acupuncture. All right, the ear acupuncture, maybe there are 200 points here on the ear, and if you look at the picture, every organ is on the ear. Fantastic for things like addiction, alcohol addiction. All right. Also good for pain management. Right. And of course, I wish I had the time to learn Sujok. And I apologize if I have used the wrong chart to indicate the principles of Sujok. Okay, Dr. Zarina, who will be organizing the coaching workshop, okay, is expert in Sujok. All right, she's an international trainer. So these are imaging correspondence theory. You image, you kind of imagine, this part correspond to another organ. So Tung Acupuncture, the second principle of Tung is imaging. Image. A popular image is the elbow is the knee. All right. So TCM will needle, as you can see in the picture, he will needle right knee, he will needle on the knee. Although he will needle other points too. Right? Tung. Where does Tung needle for knee pain? There are many areas. Sometimes popular is at the finger, but LI11, LI11 at the elbow is a treatment for knee pain for in the Tung system. All right, but we have to know where the pain channel is. Meaning, sometimes it is LI11, sometimes it's 3312. 3312 is sitting on the small intestine channel. But as a shortcut, if you palpate your entire elbow, if you're having a patient right knee pain, all right, and then you palpate the left elbow area, all right, you palpate elbow and little bit up, little bit down, all right, and if there are RC points, you can needle those RC points, all right. That would be the treatment style of the Tung system. Okay, let's look at this this image. Let's look at this image. Now, let's look at this image. Elbow is the knee. So, using this same image, a patient with ankle pain comes in. Ankle pain comes in. The favorite point to needle ankle sprain is this point that is on the picture. All right, it is many say it's magical. All right, but I love to have a patient who comes limping into my clinic with ankle sprain, because with this point, and it's only 1 point. All right, seldom is 1 point. All right, seldom. Don't believe when people say, oh, Tung acupuncture only use 1 point. All right, seldom. Most of the time we use 5 or 6 points. But ankle sprain can work even with 1 point. And this is the point on the picture. How to needle? It has to be, taught to you live. How? In fact, I give you a tip. You put in a needle at A05 and you you do a subcutaneous needling to pericardium 7, just one needle. All right. And the pain will be relieved. He will walk out, well, and he still have to come in 2 days to have a repeat treatment, but he will get better and better. He maybe need 4 or 5 treatment. Now, but what I want to explain now is, can you see the mirror format? Where is the ankle and where is the hand? The ankle is at the wrist. This is the mirroring. Just now at the knee, the elbow is the knee. Now the ankle is the wrist area. All right. So it works in a vice versa form. If you have a wrist pain on the right hand, you can palpate the ankle on the left leg. And wherever there is archie around the ankle, you can needle in order to treat the wrist pain. So just in case you're lost, don't be lost. Now we are talking about imaging correspondence, which means the theory, the principles behind the choice of tongue points. Now you're looking at 2204, 2204, 2205 is the top combination point of the tongue system. In TCM, the top point is LI4 or stomach 36. These two are the top points. In the tongue system, it is 2205, treats 100 issues. So it is popular for low back pain and sciatica. Right. So can you see the wrist in this imaging? This imaging, all right, the wrist corresponds to the sacrum area, front and back. In this image, the wrist corresponds to the ankle. All right. There are many images. The image correspondence is not only one chart. There are multiple image systems, multiple correspondence. All right. So I repeat. In this case, the wrist is the ankle. In this case, the wrist is the sacrum area. The wrist is also the neck. All right, there is points. If you have a neck issue, you can also palpate your wrist. Okay, TCM. Pericardium 6 is also top point, maybe top 5 in the TCM system. I will show you where is pericardium 6. It's here. Can you see my arrow? Can you see my arrow? Can you see my arrow? Pericardium 6 is here. And where does it? Pericardium 6 can treat the chest. For that reason, pericardium 6 treats the heart and also chest. All right. Pericardium 6 also abdomen. All right. So using imaging, we can kind of understand why certain points treat certain areas of the body. So headache. Can you see this correspondence? The foot is the head. The foot is the head. All the points around the foot, around here. Liver 2, liver 3, all right, in the TCM system. In the tongue system, all these TCM points can treat headache. Stomach 43 is a common point in the tongue system to treat headache. Stomach 43 is the same as 6605, all right? But we have 6605, 6, 7, 8, 9, all here. You see, the imaging says that this area, okay, represents like a forehead, like the forehead. To TCM, from this image, you can gather why spleen 6 is a gynecological point for uterus, feminine issues, all right? Because it images the lower abdomen, stomach 6. Eyes, again, the foot is the head. I will move a bit faster. This one. What point is this? What point is this? Okay, there's a question. Only one point in needle is enough for headache? No. Sometimes 2 or 3. Okay, kidney 1. All right. Oh, many TCM practitioners in this group. Fantastic. Fantastic. You learn Tung and you become super. Now, kidney 1. Kidney 1. Do you agree? We use kidney 1 to treat a coma patient. Agree? And brain issues, kidney 1 is superb. Yes. Improve memory, kidney 1. Brain tumor, yes, can. Good. Now, can you understand why, from the imaging theory, that the kidney 1 is effective for the brain? Kidney 1. The lowest point will treat the highest point, and the highest point is the brain. Okay, master. Tonification, okay, in Tung system, there's no tonification sedation. You put in the point, all right? And a Tung practitioner uses all the point in the TCM system. Okay, only sometimes with different principles. So, neck pain. Now, neck pain. Earlier, I've already mentioned the wrist is the neck, but the ankle is also the neck. All right, ankle is neck. So, again, this is a quick tip. If you have a patient with neck pain, you palpate the area around the ankle. All right, maybe BL60, kidney 3. You don't worry about the point location. As long as when you needle, you are not piercing any important nerve, ligament, tendon, all right, or tissues, all right. So you, for that reason, you need to know your anatomy. But wherever there's arshi means it's only tender when you press. All right. If the patient says, "Oh, I didn't know I got injury at the ankle," no, means it's not injured. It's just an arshi points. So arshi points around the ankle is good and fantastic to treat neck issues. Vamsi, are we still okay?
Yes, sir. Yes, sir. Yes.
Yeah. Half tune needles you use at zone 1. Zone 1, half tune is enough. You can even use Sujok needles for zone 1. All right. Zone 2, the needle gets to be a bit longer. And when you get into very fleshy, you can use up to 2 tune, 3 tune. All right. So, is everybody comfortable? Is everybody comfortable? Is everybody all right? Say something. Everybody following? Following. Okay, good. Okay, so thank you. Okay, now in holographic correspondence, holographic correspondence, all right, as I say, there are many images, but this image that I'm showing to you is very, very interesting. Yeah. Second method couple. All right. Second method couple. All right. Okay. Li4 is around here. Li4 is here. But nowadays, some practitioners have moved Li4 to the bone. This bone itself can treat the entire body. This bone itself, by the side. All right. You palpate. All right. I will stop sharing. Okay, good. Okay. Okay. Do you want a break? Vamsi, do you want a break? Not yet,
just 5 minutes, 1 hour completed, na? Just some for your relaxation. 5 minutes break, it will be better.
Already 1 hour. Okay. Let me finish this.
Okay, done, sir. Done.
Give me 2 minutes, huh? Give me 2 minutes, all right?
Okay. You can continue, sir. You can continue. Afterwards, you can give a break. Yes, sir.
You see the second method couple, all right? You take some tool or even your finger and you palpate along the entire. You palpate, all right? There are actually 12 points. 12 points there. There are 12 points, all right? Head, neck, upper limb, lung, heart, liver, stomach, duodenum, kidney, waist, lower abdomen, leg, foot, all right? I don't use this often, but sometimes I really get into trouble with certain patients. Everything I do, I got no success. All right? Then I will resort to this. I will palpate slowly, bit by bit. And wherever there's Ashi, I will put a point there. And if there are 3 points which are Ashi, I will put 3 points. All right? This form of acupuncture is very famous. Used to be very famous in China. There was some controversy, and this system is used in the US now because of the students of that Chinese doctor, his students who migrated to the States. All right. So this is interesting, is simple. You can try it. Right? Wherever there's Ashi, you put a needle. It will be great. Okay, so we take a 5 minutes break, everybody. 5 minutes.
Yes, sir.
Okay, then.
Yes, just 5 minutes and we can continue on 9:30 onwards. The doubt session will be there and final, the link will be sharing. Yes, sir.
Okay, then. All right.
Yes. I will continue. Yes. So friends, so I think so you had enjoyed today, you are enjoying today's class also. Friends, I hope you are enjoying today's class also. Yes, you can text. Yes. Thank you. So Lee sir, after conducting many programs in India, who are new, for them I am saying. So previously I had conducted many programs in India. He was very interested in conducting in India. Why means many practitioners are practicing Tung Acupuncture in India. Sir said more people are from India only practicing and getting good result from Tung Acupuncture. So Lee sir was coming in the this month October, to Hyderabad and other places. So I will share the link. So those who are interested for his practical class, they can join. So I'm sharing the details about the upcoming classes of Lee sir. Those who are interested, they can join in that courses. Just I'm sharing that upcoming programs. So this was a 4 places Lee sir was coming this month. So October and November. So it was a live practical class. Here you are learning the theory, but practical is also important. So it will be a practical class. So and also you'll be getting the sir will explain, sir. The doubt sir will explain. So the certification also getting from international certification from Lee Institution, Malaysia. So the dates, if you are interested, you can take the screenshot. Afterwards, you can contact to the organizers. So Hyderabad and Bangalore looking by me, and Mumbai and my colleagues are looking, Cochin. So anywhere nearest you can train from the Lee sir. International standard, the training will be it will be in international standards. I think so. He had trained more than 2,000 people all over India and globe also. Malaysia also is to conduct regular programs in other places also. Lee sir. And I will share the course content for 2 days. The course, the 2 days content will be this. You can take the screenshot and I will share in the group also. So who are attending today? So for them, I am posting. Yesterday, many people had joined. Sir, the training fee will be very nominal fee. It will be around 10K Indian currency, and he will be in that he was giving 2 books free of cost. It will be cost around 8,000 in Amazon or Flipkart. You can check. This was the course content. You can see the course content. Anybody interested, you can contact that numbers, and it will also shared in the books or ebooks. Sir, here the link will be shared today. The link will be shared. That was ebook. If you attend the class, you will be getting the printed book, live book. And the practical will also be more there. The live class, the practicals will be there. So each and everybody will get a good practicals. Okay. And today, the half an hour, the session will be there. And after completion of 9:30, there will be a doubt session. So the Hyderabad location, everything will be shared in the group, sir, after registration. Ebook you will send, sir. Ebook you will send. And yesterday, who had missed the class, we had posted the YouTube link also in the group. So you can join in that group. In that free group, who are not there, again, I'm sharing the link. You can join in the group. Chat box, I will share the link. Who are not there in the group, they can join in the group. Everything will be updated in the group. Okay. Sir, you can start, sir. Please, sir. Please, sir, you can continue, sir. Thank you. You can continue. Thank you to all. Please, sir, your voice is not there. I think so. I am not listening your voice.
Okay.
Unmute.
So
Right.
I have just completed imaging correspondence, all right, or holographic correspondence. TCM practitioners. TCM practitioners. What is the point of hemorrhoid? Hemorrhoids. What point do we use in TCM? Hemorrhoids. Of course, there are many points, all right? One of the point is DU20. TCM. DU20. All right? DU20. And DU20 to treat hemorrhoid is a imaging correspondence principles. Mind you, TCM has a lot of imaging correspondence, only that is not much kind of explained, right? But there is. The third principle of the Tung Acupuncture is tissue correspondence. Absolutely useful and absolutely easy to understand. Tissue correspondence. Tendon treats tendon. If you have a tendon issue, you should put a needle in another tendon. Tendon treats tendon. All right. Neck pain. Many times the neck pain is due to tendon. It's not necessarily due to a bone spur. All right. So if you have a neck pain which is tendon related, you then needle the Achilles tendon. All right. The Achilles tendon is the biggest tendon in the body. All right. It's just fantastic when you needle this tendon. All right. Of course, many of you who are not familiar, you will think that there's a lot of pain. There is no pain. All right. For those of you who have attended my class, you can write in a chat group and reassure others that there is no pain when you correctly needle 7701, 2 or 3. All right. So now you understand why we needle these points to treat neck pain, because tendon treats tendon. Muscle treats muscle. If you have muscle atrophy, means wasting of muscles, then the needle should be placed in an area which has a lot of muscle. And 4406 is one of the favorite place to needle for muscle atrophy. Big mass of muscle. Bone treats bone. All right. So there are points here. Okay. This needle has to touch the bone, not drill the bone. All right. There are 2 points here where there's a bone protrusion. You put a needle and you kind of just touch the bone. And this point indication is rheumatoid arthritis. All right. Bones issue. Bone treats bone. Now, what do you think this will treat? When you plum blossom the skin, what can it treat? Skin treats skin. Skin treats skin. So this tool is useful when you have a skin issue. All right. Skin treats skin. Psoriasis, eczema can. All right. As long as you tap the skin, because when you tap a skin, it treats skin throughout the body. All right. That is the underlying principle. Bone treat bone, muscle treat muscle, tendon treat tendon, skin treat skin. All right. So blood treats blood. Blood treats blood. In the Tung system, I do not use the word world of bloodletting. I use the word universe of bloodletting. Okay? In your mind, you take a bit of a focus now. Bloodletting, you can say, is 50% of Tung. It's not 10% of Tung. Bloodletting in Tung is absolutely important. This is one of the big difference between TCM and Tung system. Again, no one is more superior than the other. But when you learn Tung, you become a specialist in bloodletting. Because bloodletting is inside Tung. If you have a case whereby you cannot crack, wherever you put the needle, it doesn't work, then you resort to bloodletting. Bloodletting will help you open up your case. It will make your needling more effective. Then your needling will be effective. A simple place to bleed is the ear. Is the ear. For those of you who come to my training, just learning the simple procedure of how to bleed the ear will, in value, be the whole course fee that you pay. If all you pay the course fee and all that you learn is to bleed the ear, it is value for money. I use bleeding the ear every day in my clinic. Any issues connected to the head sensory organ, you can bloodlet the ear. Bleeding the ear moves blood throughout the body, not only on the head. To the TCM practitioners who are skeptical, you know that there are so many meridians circulating the ear. When you bleed the ear, you trigger all the meridians around the ear, all right? And that is like the whole body. So although blood treats blood is like a small principle in Tung, but in procedure, it is a big topic. It's a big topic. I devote quite a bit of time to demonstrate how to bleed. All right. Hijama is bloodletting. It's blood treats blood. All right. I'm not sure whether my good friend Dr. Junaid Khan is in this webinar. All right. But those of you who are in Bangalore, you are blessed with him there. Hijama Wellness Center, I think. Dr. Junaid Khan, he's India famous, world famous, and he eats and sleep hijama. All right. He eats and sleep. Okay. So this bleed cup is hijama style. Hijama style bleeding is part of Tung. Right. But there are other forms of bleeding, like ear bleeding, and then vein bleeding. All right, like the one in this picture. All right. We definitely got no time to talk more, but I I hope to impress on practitioners, acupuncturists that please invest your energies to learn bloodletting. You know, how old is acupuncture? Okay, let's have a chat now. How many years old is acupuncture? 4,000 years old. Joseph Frederick Fernando. 5,000, 3,000. All right. Ooh, 8,000. Okay. Okay. So let's say it's 2,000 years or 1,000 years ago. Imagine 1,000 years ago or 2,000 years ago, what is the acupuncture needle like? What did they use? There was no stainless steel, no metal, not even iron age, bones, thorns, bamboo, rock, stone. Okay, so nobody said needle. Can you imagine all those things that you mentioned, thorns and bamboo and stone, when they put it in the body, do you think there is blood coming out? Yes or no? 2,000 years ago, acupuncture practitioners, do you think blood comes out from the insertion? As far as I'm concerned, yes, 100%. And now the books, those from the Yellow Emperor and those tracking the history, they have read and they found that bleeding started before acupuncture. Actually, acupuncture is the wrong word because acupuncture means needle puncture. So it is not. All right. The history of Chinese medicine insertion into the body is not needle, it is bloodletting. Right. But I'm not here to debate because we are practitioners of both style. And it's just from my experience that bloodletting, I mean, those having blood issues and too much warfarin, and those are the precautions you need to take when you practice bloodletting. And the amount of blood that comes out in the Tung system is not important. We do not stress that more blood means more success, not necessary. But that, come for class, all right? So blood for blood. What about this? Yes. This is blood treat blood. Whenever you use this tool, all right, there is bloodletting. Only that the blood doesn't come out. The bloodletting is under the skin. But the therapeutic effect is the same as bloodletting. All right. It is my favorite tool, this one. Okay. If I have to choose between this and an acupuncture needle, sorry to say, I choose this. If I only have to have one. The guasa treats the blood and blood treats blood. Okay, we are a bit coming to the end, but I got many little tips I want to share, all right? When you do bloodletting, when you bleed the ear for, let's say, frozen shoulder, you can bleed the ear for frozen shoulder. By the way, when you do bloodletting, you always bleed the same side. The needle, you needle the opposite side of pain. Bloodletting, you have to needle the same side. All right. If after bloodletting, there is no relief at the shoulder, at the frozen shoulder, or wherever pain that you are trying to treat. If after bleeding the ear, there is no relief, zero relief, nothing, then you must note that this is a difficult case for you. All right, you have to be ready to do battle with this case. All right. Of course, the blood the bloodletting doesn't mean that you have cured him, all right? But bloodletting usually gives a positive. The pain will be less because bloodletting of the ear moves blood throughout the body. Okay, and if there is a relief, then you know, good. Then stomach 38 will work very well. All right, so there's bloodletting. So everybody is waiting for this book. Okay. This is a physical book. Physical book, and I feel happy to be able to give these two books free for those who attend workshop. All right. And to reward you for staying around for this webinar, all right, to reward you. In fact, you should reward me, all right, but it doesn't matter. I reward you. Okay, I will give you the free link to read these two books in for 5 days, all right, for 5 days, all right. And after reading, you can message me to buy the digital book, all right. If you want to buy the physical book, you can go to Amazon India to buy. But the digital book is something very precious, and I want to spend 10 minutes to show you the digital book. It will be sold at maybe 6,000 rupees, the digital book, maybe 8,000, all right? But I will think of a good price in 5 minutes, all right? In 5 minutes, you know, for those who, after reading, after testing the digital book, you feel that you would like to purchase, all right? I will give you the price. Only for those who attended the webinar. Digital book price for those who attend the webinar. Physical book versus digital book, all right? Not to sound like a businessman, please buy both. All right, please own a digital book and own a physical book. Both have their advantages. Okay, I'm going to share the link very soon in the chat group. All right, very soon. But I am going to show you the digital book now so that when you receive it, you can better use it. All right, you will know how to use it better, the digital book. This is the digital book. Okay, the digital book. 2 books. 1 book on diseases, 1 book on points. All right. Okay, let's look at some points. Vamsi, everybody can see the screen?
Yes, sir. Yes, sir. They can see, sir. They can see.
Okay, let's look at TCM acupuncture points. Okay, and large intestine. Imagine you want to study on your own, all right? You kind of forgot where is Li12. You forgot where is Li12. So, all right. So there are 400 TCM points in this digital book, all right? With the location, dermatome, main action areas, main function, indication, manipulation, and I will tell you whether moxibustion is applicable. All right. So 400 points here. And if you want to learn about Tung points, there are 200 Tung points here. Example 1106, favorite point for infertility. All right. Okay, 1106, location, Sanjao, reaction area. All this is advanced subjects, not for this webinar. And these are the indication of this point. Infertility, uterine pain, irregular menstruation, blah, 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 blah. All right. All right. So these are the points. Let us say, I need to take a break. I need to take a break. Just give me 2 minutes. Sorry. Can you all hear me? Can you hear me?
Yes, sir. Yes, sir.
Can hear. Okay, now let's get into the crux. All right, the diseases. All right, 72 common diseases. Okay. Somebody tell me a disease that you want to discuss. Okay, doesn't matter. Diabetes. Diabetes is under other diseases. Other diseases. Diabetes. So this you are going to have. So you pick the disease that you want to know. Now, these points are points that I have extracted from experienced Tung practitioners, means the expert in Tung acupuncture. How do they treat diabetes? All right. So I have put it and summarized it in a page like this. So this is how they treat the diabetes. All right. Then I've given you a quick look at the points. These are the points to treat diabetes. A quick look. Then you want to have more details. Example here. Combine 8809, 8810, 8811. All right. 88 means at the thigh. When you are having a physical book, you then go to book 2, the points book, to find out the details about 8809. But in the digital book, you merely click 8809. And you have 8809. This is 8809. All right. So it is quite obvious the benefit of having a digital book. And the book is sitting in the cloud, which means you can access the book from anywhere as long as you have internet. You can access from mobile. You can access from laptop, desktop, pad, any device, and you can see it in multiple devices, even 10 devices. It is something I'm very happy that I have created. All right. I will go through the contents. Just give me another minute. All right. So there's an introduction. Some of the theories are inside here. The diseases are there. and then the points. But the disease is hyperlinked into the points. Right? That is why I am very happy with this creation. So this is the agenda for my workshop. All right, for my workshop. I really want to end now so that I can give more time for questions. Is that okay, Dr. Vamsi?
Yes, sir. Yes, sir. What we will do now, the doubt session will be there. After that, last final, we will post the link in the chat box, sir.
Yeah.
So the today we'll do different, sir. Today, Lisa, today we'll do in a different way the doubt session. They can text, sir. By seeing that, you can explain easily. It will be easy.
Yeah.
Text. Why
Yes.
means direct? It was taking more time. So they can text. If that doubt you can see and you can explain. All people can know.
When okay. So what question? Which question shall I answer first?
No, you can check the chat box, sir. You can check the chat box that you can clarify the doubts. Chat box, they're texting. Chat.
Yeah. So
Not the book session, the doubt session, any cervical spondylosis treatment. Example. Point for gout. That's some points they're asking. If they're important, you can explain, sir. Simple fact.
point for gout. Do bloodletting. All right. Wait, give me a minute. Everybody, please follow.
Sir, please text slowly the friends who are in the class. One by one, they can text. Why means many, all are there in that record, what he was giving book. But important, if you ask, it will be helpful to all.
To answer gout, I use quite a bit of bloodletting, and I use stomach 36. Right, stomach 36 is my favorite points for metabolic issues. Right. Okay. Tremor, please read the section on Parkinson. All right. In the Tung system, we treat the kidney and the liver for Parkinson. But can I impress on you that because you are going to have the treatment for 72 diseases, which are common diseases you face in your clinic, you really don't have to worry about the treatment. All right, you have to ask me more general issues. All right, more general issues, better. Okay, if you have some doubts in the system, better. After open heart surgery for fast recovery, I'm not sure. Okay. Just like what I say yesterday, all right? How good are we at treating pain? You might not like what I say, but you must be an expert in treating pain. all the other issues, umbilical hernia, autism, I treat, but if you're a new acupuncturist, please concentrate on how to handle pain. Pain is not as easy as we think it is. All right. Okay. If you start the practice, you must know how to solve low back pain, sciatica, shoulder. All right. Heel pain, ankle pain, knee pain. Of course, headache. Of course, headache. All right.
Sir, Lee sir, we will do one thing, sir. Our Sabari Karthik will read the questions. Then you can explain. It will be easy.
Yeah,
Karthik is
because
there, right?
I'm a bit confused.
No, not what I mean to say. They are continue asking. So Karthik will ask important questions that you can answer. It will be.
Yeah. But I think we are not getting progress if you keep on asking me how to treat the cancer, how to treat cervical
Sir,
spondylosis.
important.
No. So try to have more general question. All right.
Yes, sir. Karthik sir.
Yes. Okay. Carry on.
Karthik sir. Karthik sir. Sabari Karthik. Karthik sir, you can unmute and ask questions to the sir.
Yes, sir. Skin disorders.
No.
No, Karthik is there. I had informed to him. He will ask.
Yeah, he just unmute.
I said. Unmute. I had unmuted him.
Skin disorders.
My goodness, all the questions. Not even one is about pain.
Total book, all the books, all the points are coming, sir. What are the diseases? Total was coming. Karthik sir.
Yes, I can hear. Can you hear me?
Just read important, which will be helpful to all. The question will be important to all.
Skin disorders.
What order?
Skin disorders.
Again?
Skin disorders. Skin disorders.
Skin disorder.
Skin.
Skin disorders.
Skin disorders.
Yes. Yes, master. Yes.
Bleed the ear and bleed BL40. All right. And plum blossom, the affected area, and tongue points, 88, 17, 18, 19, and points 11, 17.
Yes,
Do you think this is the way to learn? This is not the way to learn. I can give you all the answers, but you learn nothing. All right. This is not the way. All right. We have to have some good fundamentals. All right. All the answers that I've just said is already in the digital book. You can read at your own time. Okay. I'm going to be live only for another 10 minutes. So you have to ask me much more important questions. All right. I think everything is fine, Bamsi.
Yes, sir. Going on, sir. Fine, going on.
We are doing fine.
Yes,
All right.
But
Everybody wants to
everything
wait. Everybody wants to wait for the link. They want the link.
Main link they are waiting.
Then when I give them the link, they will all say goodbye to me. They will forget about me.
Bye, sir. Bye. Okay.
They will say bye and good night. Okay.
No, we'll give.
So maybe the link I don't give them for 5 days. Maybe I give them for 5 hours enough. All right.
Yes, sir. Yes.
Okay. Not to worry. All right. But I will just summarize and we should end because I think everybody is quite happy. All right, please, my personal recommendation, please get the 2 books, all right, and buy the digital book. All right, okay, please. All right, if you can afford it. Okay, if you cannot afford it, then that is a bit of a problem. All right, but if you can, I tell you, you buy any of these things, if after buying you're not happy with it, I will return all your money. All right, it is something I did for India. This is my present for India, to say thank you very much for taking care of me whenever I come to India. All right, it is it's just fantastic. All right, if you buy the digital book, the digital book is in the cloud, which means I will keep on upgrading the book. And when I put the videos of the point insertion into the digital book, you will get it immediately without having to pay extra money. Do you think I can put videos into the physical book? Mamsi?
Yes.
Can I put videos in the physical book?
Sir, we'll discuss, sir. We'll discuss.
No. I'm asking you now, Vamsi. Can I put videos in the real book? The physical book?
Physical book, how we can keep, sir? Physical book, how we can keep video?
So answer me.
No.
Can I put videos into the physical book? Yes or no?
No, it is not possible, no, sir. Physical book.
Yes, sir. Can I put the video in the digital book?
It possible. I think so, it's possible.
It's not possible. It's yes, I am going to put videos in the digital book.
Okay.
But by that time, I won't sell 5,000 rupees. Okay. All right. Now, but I will sell much higher. But for this class, to put a link, I'll put the link and give you a very, very special price for those who have attended the webinar. All right. Is that so? All of you, please get my personal WhatsApp. You can get my WhatsApp number from the group chat, and you can individually talk to me. And if you want to buy the digital book, after you read it, you are happy with it, you want it, you please send me a message. I will give you a price that is very fair and it will make you happy. What I want is acupuncture to grow in India. India must become very powerful in acupuncture. All right. So I thank everybody for giving your 2 days. Sorry if I'm not sorry I've not answered all your queries, but you can message me individually. And I hope to have this webinar again. Now I'm getting used to it. I will do many more. This is my first time, doing this kind of thing. All right. And for those who are attending the workshop, I look forward to seeing all of you. Okay, Vamsi, can I say goodbye now?
That link you have to share now. That link you will share now.
The link, the link. So let me see where it is. Let me see where it is. Maybe tonight I cannot find it. Wait. Where is the link?
Otherwise, you can do one thing, sir.
No. Be patient.
Okay.
Be patient.
Right.
Okay, I'm going to cut and paste. You don't have to write, all right? Copy. Go to the chat. Send to everyone in the meeting.
Yes, sir.
Everyone in the meeting. No, it doesn't work, huh?
No, you could not get the link.
Okay. Don't worry. Don't worry. Give me a minute. Everything there is a solution. Give me a
Madam,
minute.
5 days sir had mentioned, no, madam, Sunita madam, 5 days you can see that content.
Copy link. Chat group.
Yes, yes.
Please, everybody, you must have the link before it runs away from you. Can everybody see that link?
Yes, sir, it was opening. The link was opening. The link was
Have you
open.
checked? Are you checking?
Yes, sir, I had checked it was opening. You all must have to copy that link and they can open. They have to copy.
Even now, you just check the new link.
I had checked, sir, it was opening. It was opening. They have to
Okay.
copy and they can view. And again, I'm repeating, friends, the link will be in 5 days. 5 days, how much you can get the knowledge from that content. And the practical will be compulsory. The practical class will be there. If you attend the practical will also, it will be helpful.
Okay.
Okay, sir, we can close the session. So please, friends, take the link, copy the link. And any doubts, Lee sir number is there. You can WhatsApp Lee sir in the group. That number is there, admin group, admin number. Sir, you can text your number, sir. Lee sir, you can text your number, phone number.
Okay.
So any doubts regarding, you can text. The direct call will not go. WhatsApp or
WhatsApp. I like WhatsApp.
you can take the Lee sir number. Anything you can WhatsApp regarding the subject. Not other personal matters.
Yeah. Please, give me some feedback. Personally, you can WhatsApp me so that I can do better the next time.
So friends, who are having any regarding class information or something else, you can WhatsApp me. I'm also texting regarding the class sessions, Lee sir sessions in Hyderabad, Bangalore and Cochin also. I will guide the number. So the training sessions regarding in India. So again, I'm sharing this one, the classes, Lee sir programs. If you are interested, you can join. Yes, again, I'm sharing. You can take the screenshot. Theory is also important and live practical is also very much important. So if you take one-time practical training from Lee sir, it will be helpful to in future. All. Babjan sir, you can call me. I had mentioned in this one. You can call me. Tirupati Babjan sir. You can take the numbers are there. Hyderabad, Mumbai, Bangalore, Cochin. So previously, who had attended our Lee sir program, they are practicing very good and getting good results. Who are using Tung Acupuncture. Sir, Lee sir, we can close the meeting. Huh?